What do abnormal cervical cancer screening results mean? Have you ever wondered what it means when you receive an abnormal cervical cancer screening result? It can be concerning, but it is important to understand that abnormal results indicate changes in the cells of the cervix. These changes do not automatically mean you have cervical cancer. Instead, they suggest that some cervical cells appear different from normal when examined under a microscope. This can happen due to infections, inflammation, or even precancerous changes that, if left untreated, might develop into cancer over time. Cervical cancer screening usually involves two tests, the Pap test and the human papillomavirus test. The Pap test checks for abnormal cervical cells, while the human papillomavirus test looks for high-risk strains of the virus that can lead to cervical cancer. An abnormal Pap test result means that some cells collected from the cervix look unusual. However, this is not a diagnosis of cancer. There are several common types of abnormal results. One is atypical squamous cells of undetermined significance, often referred to as ASCUS. This is the most frequent abnormal finding. In this case, some cells look unusual, but it is unclear if an infection caused the changes. Other factors, like irritation or hormonal changes, can also lead to this result. Usually, a follow-up HPV test is done to see if the human papillomavirus is present. If the HPV test is negative, the abnormality may be due to non-cancerous causes. Another type is low-grade squamous intraepithelial lesion, known as LCIL. This indicates mild abnormalities often caused by human papillomavirus infection. These changes typically resolve on their own, but monitoring or further testing is necessary to ensure they do not progress. Atypical glandular cells, or AGC, are another abnormal finding. These abnormal glandular cells may suggest a more serious issue, often requiring further evaluation through procedures like colposcopy, which is a detailed examination of the cervix. High-grade squamous intraepithelial lesion, or HSIL, indicates more severe abnormalities that carry a higher risk of progressing to cancer. This usually requires prompt evaluation and treatment. Most abnormal screening results stem from infections or other benign conditions and do not indicate the presence of cancer. However, because some abnormal cells can develop into cancer if untreated, follow-up testing and monitoring are crucial. This may involve repeat Pap tests, human papillomavirus testing, colposcopy, biopsy, or treatment to remove abnormal cells. Treatment for abnormal cervical cells is generally effective and aims to prevent cervical cancer. Most individuals recover well after treatment, although some may experience temporary bleeding or discomfort. For pregnant individuals with abnormal results, management will depend on the type and severity of the abnormality. In summary, abnormal cervical cancer screening results indicate changes in cervical cells that requiring further evaluation but do not confirm cancer. Early detection through screening and appropriate follow-up care significantly reduces the risk of developing cervical cancer. It is essential to follow your healthcare provider's recommendations and seek personalized medical advice for any abnormal screening result.